Hello, everyone, and welcome to the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade. I'm a naturopathic doctor, and I'm very pleased to be joined today by fellow colleague, Dr. Taylor Bean, also a naturopathic doctor. Welcome to the podcast, Dr. Bean. And if you don't mind just taking a minute to just tell us a little bit about your practice and just how you got involved with treating patients with complex chronic illness.
Yes, thank you for having me. So my name is Dr. Taylor Bean, and I'm a naturopathic doctor in British Columbia, specifically in Salmon Arm. So we just opened a clinic 3 months ago.
With a very clever name.
Yeah, tailor-made wellness. So I thought it was
Great.
fitting.
Mm-hmm.
It actually wasn't my idea. It was a girlfriend of mine who's just like, tailor-made, you should call it. Like, you know what? That is brilliant. Yes. So tailor-made wellness, tailored to each individual need of every patient that comes in here. So the journey, my practice started in Singapore. So I first started practicing in Singapore in 2015, after the birth of my first child. And I always knew chronic illness was something that I wanted to really work with, but it wasn't very specific, I suppose, exactly. Having my son open the doors essentially for pediatrics, where I was not my focus was not going to be pediatrics, but then having a child that opened many different doors, and people were coming to me with their child because I had had a child. So that the learning curve really increased exponentially, because then I started to see children with complex conditions. And so this is where children, from behavior to skin to no one knows what's going on, we can't seem to figure it out, children. So that is what really started my journey in terms of chronic infections, complex conditions. So as I started to go down, pandas, pans, and then with that would be pitans. And so that encompassed infections. And then that was that overlap for adults as well, with very unexplained problems. And so for me was, as a naturopathic doctor here in British Columbia, it seemed there's a lot of NDs in British Columbia because that's where one of the schools is, that in Ontario. And it just seemed like a lot of NDs do women's health, for example. And to me was, I don't want to be another person that does women's health. There's so many, and therefore I can refer if need. But there doesn't seem to be a lot of NDs that are focusing on complex conditions in children or Lyme disease specifically. So it's like, well, that's where I'm going to go then, because no one's there and I'm having patients with odd things. And you know what? There's lots of NDs to refer to, which I do. And that started the path. And so it really, working with children opened the door to me of, well, adults and complex to idiopathic conditions that no one seemed to have an answer to. It's like, well, maybe you have Lyme disease, or maybe you have a co-infection, or maybe you have chronic strep. Maybe that's the problem. So that's where, and because I'm teaching children, then their parents are, of course, like, well, I have these really weird things. Maybe you can treat me. Absolutely. Mm-hmm. So that's where it hits for me. And then being in that world, of course, and attending certain conferences with other, big doctors speaking about these conditions, it's like, this feels really right to be here and be doing this, because you just learn these incredible ways to treat patients that are, you dabble in naturopathic medical school, but, in medical school, you're just learning about the body, and you're learning about, from herbal medicine to pharmaceutical, so forth. But the application of it comes after schooling, and realizing, okay, this is the demographics of people that and the need is just so grand as well, as you would know. Mm-hmm. There's just so many people that get the answer of, we don't know what's wrong with you. Be well. And to me, that's not good enough. No. Ever. And so I think that when I start to see patients have issues that no one seemed to explain why, my heart bleeds, and it's like, okay, we're going to find a solution. It's going to happen. Either I'm going to help you relieve these symptoms, but no more. And so to me, it's just a very competitive to me of I'm going to find the answer. We're open doors that haven't been open for you before, and let's see what we find. And oh my goodness, look what we found. No one's ever looked here before. And sometimes it can be quite simple, which is nice when it's simple. Like you do a full thyroid panel and you realize it is a thyroid problem, or you start testing for infections and you find, a multitude of infections, and then you go down that road, or maybe it's mold or what have you. And it's like, okay, this is where we have to go now. So yeah, it was treating children is where it started for me. Yeah.
I just interviewed Dr. Jill Krista last week. I haven't
Oh,
launched
awesome.
that episode yet, but it's just interesting because she kind of had a similar-ish backstory, and that it kind of went from like, oh, I was kind of focusing on one area, and then that opened the door to another area, and that to another area, and it's just this evolution.
Oh yeah.
Those of us who are open-minded and or foolhardy enough to be like, yeah, sure, let's just go deeper down the rabbit hole, or let's go into 17 rabbit holes all at once, then we're in this special little group. So
Oh yes, yes we are, and you can see as you learn and attend these conferences who's part of this. I really think open-minded, mavericks that are just we're not gonna stop until we find the solution. What are you doing? What are you doing? I'm gonna try that. I'm gonna try that. Oh, look, my patient. It works so well with them, and so I love that. I just love that teamwork, really, with everybody bringing to the table these other ways that they're addressing, because I will always remember this. One of my professors said in school is your patient is not a walking textbook. Like, you're right. They're never a walking textbook. You can't just flip to a page and be like, well, this is the problem, and I'm just going to do that. And then done. It just doesn't work like that. And it's very clear that it doesn't work like that. And so a textbook can offer some maybe understanding, but the solution component is lacking. And that's what we want. Obviously, okay, I have fibromyalgia. Okay, now what? Like, well, that's it. They're at the end of the road. Well, you're not at the end of the road. You're the beginning of the road. So let's go. And that's what, and I think that's why I just love this section of helping patients and seeing people with those ailments, because the sky's the limit sometimes of what you can do. And it's not just cut and dry. Oh, you have iron deficiency anemia. Iron is the answer. We're done today. There's just so much more. And I think it's very fascinating, interesting to that. Yeah, I think, which is why I gravitate towards that, and then leave the other components that my colleagues can do. Women's health, absolutely, because that's a huge component. So those more specifics, be it we know it's PCOS, we know it's endometriosis, and then they'll deal with that. Or these other angles, it's like, no, but I want to deal with, we don't know what's wrong section. I want those people. Yeah.
For folks who are listening, if you have complex chronic illness and your doctor doesn't talk the way that Dr. Bean is in terms of being so excited and enthusiastic about this, you may need to seek out another doctor who talks that enthusiastically. If you're stuck along the way, and if you're aren't, then why are you listening to this podcast, I suppose. But it's just you want some of that kind of drive and ambition and motivation, because I think I think I'm assuming it would be fair to say that, when patients are presenting and their cases are really complicated, and you're like, well, I got to help you get figured out, because you've seen so many other people who haven't figured you out yet, and I don't know who to refer you to. So we got to just keep going. And of course we have, I've had really difficult patients where I've been really fortunate to be able to chat with colleagues and, maybe refer out for different cases. But, more often than not, it's like, this is kind of the last stop along the train. So we don't really have anybody to refer on to. We got to just figure it out.
Exactly. Because the referral piece would be things that I don't have access to, be it, well, let's do some imaging is typically what the referral is going to be, to really let's rule out, just in case, if we think your migraine is due to something that we need to look at imaging for, that would be the referral. And I think I think it really hit me hard when I was in Singapore with two different parents that came in about their children. And I was the end of the line, and I was a new grad and a new mom, and I didn't know the answer, and they were similar is what they were.
Mm-hmm.
And at that point, I felt embarrassed. I actually felt embarrassed of like, how do I not know? Although they had already seen experts in the
Mm-hmm.
field,
Mm-hmm.
I actually felt embarrassed, and I really hated the feeling of, well, you're here. How do I not have the answer? How do I not? I mean, you're, be it a little bit of ego, and I'm a new grad and I probably know everything,
Mm-hmm.
but that's okay in a way, meaning, well, then I'm going to find the answer for you. Like, there has to be an answer to this question. How in the world does no one know this answer? So
Mm-hmm.
that's just, I think that hit me, shocked me. Those same thing happened twice and I didn't know the answer. I'm like, okay, this isn't going to happen to me again. Like, I'm not going to not know either maybe what's going on or how we're going to look for the answer. At that point, I was like, not prepared for this. So yeah, that curiosity and competitive to find the solution,
Mm-hmm.
but because it is so exciting
Mm-hmm.
to me when I hear someone say, like, Dr. Bean, I woke up this morning, I didn't have any pain. Like,
Mm-hmm.
that really, to me, I mean, that hits me to my core too. Again, like, my heartstrings are totally pulled because you woke up this morning without any pain. Like, hallelujah. I mean, how, like, I was able to go in the garden. I haven't been able to do that. And that is what it's totally what it's all about, completely. And this is, and I remember being in Singapore, there was a mama who led a large group of mamas. Her kiddos had autism, and they had complex conditions, which she'd worked with functional docs all over the world, and her kiddos are doing really well right now.
Mm-hmm.
And she had said, Taylor, it's the person that takes the elevator, they look healthy, but inside, like, riddled with pain. And you're taking the elevator from floor 1 to 2 to 5, because in Singapore there was like 10 stories for the mall.
Mm-hmm.
We're not going to take the stairs, but then we get looked at oddly because you look like a healthy person. And why are you in the elevator? Why don't you go take the stairs?
Mm-hmm.
I was like, you know what? You're right. Like, don't judge a book by its cover,
Mm-hmm.
because you are hurting inside. You look fine. And you also look fine to maybe your healthcare practitioner, which is why they also don't take it seriously, because you look fine and your blood work looks fine.
Yeah.
You must have a psychological issue. So we're going to refer you to a psychiatrist, which is just so degrading, because that's not what the problem is. And we're just not
100%.
going to take it seriously. So I've heard enough of those stories that I do, I get angry inside. I'm like, okay, well, you don't have a psychiatric problem. It's not in your head, because that's another one. It's just in your head. And it started, and also with mothers whom recognize something wrong with their children, and then the doctor to say to the mother, well, there's nothing wrong with your child. Like, there's nothing wrong with them. Like, I'm not sure why you don't see that as the mother. Or maybe you're just a bad mom. You just didn't notice.
Oh man.
Like, I don't know how someone in medicine who got into going into medicine to come out of it to talk to someone that way. Like, to me, is, how dare you speak to someone like that? So that's hit me so many times where I'm like, that's enough. Fine. And it stops here, and we're going to look for solutions, and hopefully we find it and uncover some things that no one can be bothered to look at, or don't want to, or don't know. Because really, you need to attend conferences with brilliant minds, and sit there with an open mind and listen to what they're saying, and like, okay, I'll take this back with me. But those conferences, I mean, they don't happen in Canada.
Not, no, no. The best ones I've been to have not been here. But I mean, now with like the Zoom era, it's
Oh yeah,
you can access it from anywhere, I suppose. But
totally. Totally.
saving
Yeah.
so much on my travel expenses these days.
Right. Totally.
But yeah,
Like, it was good to save a little money that way. But yeah, because they are expensive. But that's where the meat and potatoes happen.
mhm,
That's where it gets real and raw. And you
mhm.
can, hear some profound things that docs are doing. You're like, that's never even thought of that. And I
Yeah,
mean,
yeah.
this is where for me is the LDI came in. I mean,
Hmm.
LDI has been such a blessing for me to use in my practice. And
Amazing.
thank goodness, you do it and you offer it and I can buy it from you and
Got our
get it
little
from you.
shipping arrangement. Yeah,
Yes.
exactly.
Yeah. I think we probably have it. Although you're, obviously out east. I tell patients like it's going to take 2 to 3 weeks to get to you, even though it just comes from the other end of the
That long? Oh my
country.
gosh. There's Canada Post for you. But
It takes forever.
uh-huh.
So it is what it is. So
Mhm.
we know now how long it takes.
Sure.
And that has been just a game changer, really a
That's
game
awesome.
changer. I love LDI. And yeah, so it's been that part. But LDI, that's attending conferences and hearing about it and people
Yeah.
talking about LDI and maybe not specifically teaching on it. It's like, okay, you guys keep talking about LDI and here's one doc and in their, protocol was LDI. It's like, I need to know what this is and I need
Hmm.
to use this and clearly like I'm missing out. My
Hmm.
patients are missing out and for, it's quite simple compared to other things can be quite complicated.
Hmm.
There is complication, of course, to it in the rhythm of things, but it's also very easy and children can do
Is
it. And it's
and
just,
that's the beautiful thing. Yeah, it's
yeah,
tasteless, so easy. Anybody can take LDI if they need it.
yeah.
I was actually going to ask you about LDI because you're one of the few colleagues that I have who have, taken the made the effort to learn about LDI,
Mm.
and it as you have touched on, it can be an incredibly profound therapy for folks. So I don't think I've had a guest yet who has done LDI, so I'm excited to ask you a
Oh,
little bit about it.
interesting.
So just for folks who are listening, LDI is low dose immunotherapy. Without getting into the weeds of it, essentially it's a therapy that can be used to help desensitize the immune system if it's become hypersensitized to something. The way I like to explain it to my patients is it's kind of like doing allergy desensitization treatment. You're allergic to dust. You go to see the allergist and they inject, dilute amounts of dust under your skin at progressively higher concentrations until you are no longer sensitive to it anymore. LDI is purported to work through a somewhat different mechanism, but it's the same kind of thing where like, oh, dust issue has made my immune system cranky and now I'm all inflamed. Well, maybe the same thing can happen with the Lyme disease bacteria or yeast or strep or this or that. So if we can let that be sort of a general taster of like, what is LDI? What the heck is this stuff? Could you maybe touch a little bit on either what types of conditions you found LDI to be the most helpful for, if there's, a case or something, just to give patients a sense of like, how has this been impactful in your practice?
Yes. So actually, the first two patients that I've worked with, and many since, but the first two, they're young adults. Um, Both have autism, and you and I have had a conversation about one, but there's the two brothers, and they're in their 20s. One has no speech. He's clearly in a lot of pain because he'll hit his head severely and probably creates concussions almost every time he does it. Um, but both of them have had complex issues right from about age 2, and they're in their 20s. Um, they've done everything. They started with seeing Dr. Andrew Usman in the United States, and then they started seeing Dr. Amy Dirksen in the United States, and then now myself because she's in Canada and I'm in Canada, and she happens to be in British Columbia. So kind of the journey, and then also it was just they could not fly with them. Like that was not happening. So they couldn't fly to do visits anymore. So we had to find someone locally. So I've been working with them for about 3 years now. The older of the two, he has speech. There's he was on medication, basically just for anxiety, rage is what he was on, just to calm him down, some OCD behavior. And all of a sudden, would stop taking his medication and just stopped because he knew it'd make him feel off. And he even would take the medication of his brother and throw it away and whatnot. So he was all of a sudden one day just like, nope, this makes me feel odd. I'm not taking it. I'm not taking anything. And so we're at this roadblock of we need to do something, but what? And it was like, well, let's do LDI and let's see. And he became to a point where he's so stable that he was able to move out.
Wow.
And
That's
yeah, it
amazing. Wow.
was like this.
That was an intense situation, I remember, but
Yes.
yeah,
Yeah,
wow, that's
very,
amazing.
very intense because this the older brother, um violent, and they have had to call the police, restrain him from the mother. And so this had gone on for years. And it was the point of we need to get him to a place where he's more stable. And they saw glimpses of it from now and then. And the medication was keeping him more just under control. But then he just refused to take it. And you couldn't hide it. You couldn't, because he could feel a difference. And if you felt that difference, if you hid it, then he would get angry. And so that component. So then we started LDI, and the mom noticed when it was just like, we haven't had to call the police in a year. And then it was like, okay, we need to get him out of the house because the second brother, the younger brother, was part of his hitting his head was being aggravated by the other brother. So it's like, if we can get him out of the house, then maybe he'll stop hitting his head so much. And so then we got him out. He is back at home. Just there was a situation with where he moved to because he needs a little bit of assistance, but he's back. But he's doing well. And we were using from yeast is the one that we've been using. We've also gone down the line of Bartonella as well. But we're on a really good rhythm, and we're recognizing when maybe that's too much, maybe it's too frequent, and reduced. But it's one of my first cases that because we're at a point of like, we need to do something. What are we going to do? And so I said, let's do LDI. And the mom is like, okay, well, you make sure that you never like leave because you need to maintain helping me with LDI. So that's not going to happen. You will always be able to get LDI. Because I was considering bringing it in, but at this point I'm not. They just order from you, and it's just much easier that way, and it's easy. So, I'm happy to continue doing that, and get them what they need. And so that's been the first. And so since then, and that's just probably one of the best examples actually, because these two individuals, these two brothers, can't communicate how they feel. They can't really tell me and tell her how we're feeling. So then I can gauge what to do, because with everyone else, it's like, okay, how do you feel? Like, oh, I felt more lethargic or pain or what have you, or I felt amazing. And then it went away after X amount of days. I can get the feedback from those two, and we're completely objective, 100% objective with that, where less head hitting or it's less rage completely, because they can't say, oh, I'm feeling great today. None of that. It's so that's been amazing. There has been one patient I can recall less pain, and it's just like 90% less pain. And we had been doing other things, right? So just to notice where we were at and the reduction of, it's like, a significant difference.
Mhm.
Um, so
One
those
one
are,
just quick little introduction question, if you don't mind, because I know in my practice at least, oftentimes when I bring in LDI, unless it's a case where it's like, the patient just won't take anything, like, you have to get something tasteless like LDI, like little drops, like, sometimes we'll lead with the LDI depending on the case, but more often than not, usually there's a protocol in place, and then we bring in the LDI as kind of this new variable. And I think that's one of the reasons, for me at least, that I feel like, oh wow, I can really attest to how potent and powerful LDI can be for patients, because they're already on a protocol, they're on a certain trajectory, or maybe they've plateaued. We add in the LDI and then boom, like we see the change, if
oh
it
yeah,
works. I mean, of course, it doesn't help everybody, unfortunately, but
yeah, yeah.
in your practice, is it a similar kind of thing where like LDI kind of becomes like you kind of see it as almost like a standalone, or like just a new single variable, so you can really tell like, is the LDI helping or not?
Yes, because in the beginning of hearing about LDI, and what I was learning from people is that they would start with your regular what you're going to do, and then LDI was then added in as a layer. So
Mm-hmm.
I've been doing that. I haven't led with LDI yet, but and I may start leading with LDI, but I haven't led with it yet. I've wanted to more so do more work before it comes in,
Mm-hmm.
be it's going to have a more profound effect, a longer lasting effect, because I've sort of removed some other things before we go into the LDI. The
Mm-hmm.
one example of, the boy that I worked with, the brother, I mean, we had done very minor. He would pick and choose when it came to a supplement or a medication, because you can physically see it.
Mm-hmm.
And he would pick and choose, pick and choose. But the LDI, so you only, I think I can recall only 3 or 4 supplements really that he was taking, but he started to just spit them out. He'd throw them he'd throw them down the stairs. And
Mm-hmm.
it's like, I'm not taking this. I'm not doing, you can't tell me what to do. It's just one of these. And so it was like, okay, what about the LDI? And yeah, oral, and it was in a syringe, and he'd open for it because it was just like water. And there wasn't that feeling, because he felt drugged on the drugs that he was
Mm-hmm.
on, and he could make that connection.
Mm-hmm.
But he basically, it was essentially felt like I was leading, because I wasn't doing, we hadn't tested him for anything. He would not take a needle. Like it was completely impossible to get blood work.
Mm-hmm.
And so, and with that point, then this is where with some patients with that impossible to maybe do some testing of it, of knowing if there's any infections, then I will start the LDI to see if there's an effect. And that will tell me, okay, this infection's a problem as a result. And so that has been really helpful with patients, because like, okay, the testing is very expensive. B, there's no way you're going to get blood out of my child. So C, we start with LDI, and very, very gentle. I usually start very gentle at the highest potency I will start. So meaning like in the 20s, I usually start with. And
Mm-hmm.
I've had people who respond to those. And so, and I think I've mentioned this to you before, it's almost so out west, we're a little bit more sensitive. I find patients are quite sensitive
Mm-hmm.
than maybe patients out east, but I start with a higher potency and they feel it.
That's great.
Yeah.
Yeah.
So it's, and then we, or not, then we jump down
Mm-hmm.
more quickly.
Yeah.
But yeah, the option to, the understanding how to, and then the patient recognizes of like, oh, my energy is better, or the pain is better. And I don't understand how this is really working, but I'm feeling better. Like,
Mm-hmm.
we can go through and I
Excellent.
explain it again, but they're just like,
Yeah.
I don't really actually care. Like I feel better, and it's not hurting them. It's resolving the problem is what it's doing. And so that's been a huge part of my practice now of implementing that. Yeah.
Awesome. Oh, it's
Yeah.
great. I'm glad you're
Yeah.
doing it, and keep spreading the word, because I'd really
Mhm.
love to see more clinicians using
Me
it.
too.
Um,
Yeah. I really thought that there would have been a lot.
I
No.
honestly, I think it's and just to maybe give the listeners a little bit of a look behind the curtain, is like, well, like, why is Dr. Bean like getting her patients to get it from, across the country? It's a really big logistical hassle. The formulas are quite expensive to get on get them on hand in the first place, and then they have to be endlessly diluted. It takes all to make all these different potencies and whatnot, and then you're storing them in the fridge. Like we have a whole fridge full of these things. Like
Yeah.
it occupies a fair bit of time for my staff. It's probably like one staff member's quarter time job, like all week, like dealing with LDIs. So I think that it's probably that startup process, and then just the logistics of actually distributing it. It's a bit
It is.
cumbersome, and
Yeah.
we've got it down to a science. So we're happy to
Yeah.
facilitate that for other clinics. But I think that's the biggest
Yeah.
hurdle.
Right.
But
Yeah.
anyway.
Totally. Cause I was just in, oh my goodness, his name will come to me, but another naturopathic doctor's office. And yeah, he does LDI. This is in the States. And it was like, oh my, like you've got 3 fridges. It was kind of one of those overwhelming parts of, I don't know if I really just want exactly the logistics get into this.
Yeah.
And I think then is me asking you if I can get them from you, and you said yes, was like, okay, this solves this problem.
Easy.
Or maybe other docs are like, where am I supposed to get this from? How I don't get it, how I'm going to do all of this. And I think it is a little bit, it's an unfortunate.
Yeah.
It's daunting. So I don't have to deal with it, which is great.
I'm glad everybody's happy. So
everyone's happy. It's good.
Exactly.
I just sent an email and you guys do it, and it gets to my patients, and we're happy. We're good. It works.
Perfect.
So yeah.
Well, another question I have for you, Dr. Bean, just around testing, actually. So would you be able to rhyme off maybe like the top 3 to 5 tests that you like to run or that you'll commonly run in your practice when it comes to managing patients with complex chronic illness? And maybe what we could do is, because I'm sure, I know for me anyways, I'm assuming it's the same for you. It kind of differs whether, pediatric patients, like child on the spectrum or whatnot versus, say an adult who has complex chronic illness. So maybe I'll ask within the context of adults with complex chronic illness, just because we've kind of had a little bit more of a ped focus so far, if that's okay. So just adults, complex cases. Of course, adults can be on the spectrum, but you know what I mean. Neurotypical adults, complex chronic illness. What would be some of your favorite tests?
Absolutely. Because it is different for children versus adults. So I will start with more advanced blood work. So in British Columbia, I don't know out east, but we can write and do blood work here. So I can use a local lab. And it's private, so the patient is paying. So I will dig in terms of a full thyroid panel. We're doing your TSH, your T4, your T3, your antibodies. Because in British Columbia, if a medical doctor writes T3 and T4, MSP will kick it off. They will dictate.
Same for the most part.
Okay. Yeah. So I'll do that. And look at, autoimmune to homocysteine to inflammatory markers. We'll start. That's one test.
And sorry to interject. Would that be like ESR and CRP or other inflammatory markers?
Yes,
okay.
Exactly. Yeah, we'll do that. And then I will also use the BC-CDC as well. I do that a lot. And I think my colleagues don't know that they can, but you can. And so I will draw the blood in house and I will ship that to the BC Center of Disease Control. And I'm looking for, we don't have a lot of options, but I can look at Epstein-Barr virus, cytomegalovirus. There is Lyme on there and Babesia on there. So I will put it on there and maybe it will show up. So I will do some infections with local labs because it is a free test for them to do. So I will do that. So that's kind of the first layer. Secondly is then more advanced testing for infections. And I do use Armin labs. I do send to Germany. And so we're going to look at Lyme. We're going to look at co-infections that way. Then we'll look at mold. I do like to do a mycotoxin test. And so although I'm in the Shuswap, which is a bit more dry, I have a lot of patients on the coast, very damp. And we have caught things. We have caught things on that mold test, which I usually use. Great Plains mycotoxin test is what I typically use. Yeah. Okay. Right on. I haven't used real-time labs. I've used Great Plains, and be it if I do an organic acid test, maybe with patients, with adults, they do have some markers for mold on there, but it's
Mhm.
not as, they're not looking for as many as on the specific mycotoxin test.
Mhm.
And so I kind of find that local labs, we can find, okay, maybe there's something going on with endocrine system. Maybe your iron is super low. Let's look at that, and a full spectrum of iron for that. Is there some inflammation? Is there autoimmunity? Are there infections? And then next is to look for infections. And then depending on your symptoms, then we'll do a mold test. And that's kind of would be my top three for patients, is what I'm usually doing. I use the BCCDC quite a bit, and I have found just recently, she's 20 and debilitating fatigue. Everyone just basically chalked it up to being a lazy 20-year-old,
Cool.
off to university, college. She was in here, and we ran some thyroid and iron, and I ran that Epstein-Barr on her, and it came back positive IgA. And so, like, okay, we are going to IgM, sorry, we're going to treat you because you have an active Epstein-Barr virus infection. And no one bothered to look, because why would a 20-year-old, I suppose, have mono? I mean, why
Lots of
would you?
20-year-olds have mono. Like, I mean, so many patients have that in their history, right? I was in my 20s, I had mono. So
Right. But no one was looking for it. And it was
yeah.
just like, well, I don't know why you're tired.
Mhm.
Go exercise or get out there. It was
Yeah.
just the excuse for her of why she's tired, to me, is just such a disservice, and
Mhm.
frankly lazy is what it is. Let's call it what it is, because testing her for Epstein-Barr meant another blood draw sent somewhere else, something else that I have to review and treat.
Mhm.
Why can't I
Mhm.
just know what it is in this moment and treat you, and then goodbye?
Sure.
So she came here and instantly was like, you have mono. Like, that is what you have right now, and we're going to treat that. You have an acute infection right now.
Mhm.
And the mom was like, I can't believe that I can't believe it. Like,
Mhm.
well, this is what happens when you dig. And that was, in a way, a simple but such an effective way of finding something that was really cheap too. Um, and I think that patients don't know that, yeah, you can look at these chronic infections as well, do the first free layer, I
Mhm.
think,
Sure.
and see if you find something.
Yeah.
And then let's go from there. Let's go to more advanced stuff. So I have done that quite a bit. Even things like B12 or vitamin D, these aren't typical to put
Mhm.
on blood work, and they do serve some value, and why not? And so, yeah, I've found some really low B12s, and wow, that B12 shot did a 180 for that patient. And
Mhm.
it was just B12. B12 lately has been really, I'm not sure if it's a Shuswap Okanagan thing, but my patients are really responding really well to B12.
Mm.
In Maple Ridge, I had done a ton, but it's so interesting to find the difference actually in the region. And
Mm.
I can't exactly figure it out, but I've been doing a lot of B12 shots, and for that fatigue, and that's really turned them around. I have also, though, diagnosed about 3 patients now with Lyme, which doesn't maybe sound like a lot, but having this clinic open for 3 months, the level it feels like of people that with the potential of having Lyme is greater than I thought I saw in Maple Ridge.
Yeah.
So, we are in beautiful country where there are ticks, and it's more of a dry, humid, place. And be it, this is just where they thrive a bit more than in a damp.
Mhm.
But in Maple Ridge, of course, there's just sort of less, well, or the lower mainland, less forest. Here you're just in it all the time, and you live on, you have a couple acres and you live where they live.
Right.
So, anyways, so yeah, so that's sort of my top 3, I would
Okay.
say.
Great.
Yeah.
I have a follow-up question, and just before I ask it, it's a good time just to mention that everything we're discussing is for informational purposes only. This is not medical advice in any way, shape, or form. Please talk to your personal healthcare provider about any health decisions that you want to pursue for yourself. So,
Mhm.
with the patient with mono or say with chronic EBV, could you just speak a little bit to what types of therapeutics you
Mhm.
work with to help resolve that type of infection?
Mhm. So it always is based, I don't always, but I give the option of if we're going to do medication or
Hmm.
if we're going to do herbal,
Hmm.
and use nutraceuticals because of cost. And so I always preface that of, okay, these are our two options or are our options. Um, this patient, she's like, I can't afford anything. So I'd like to do the medication. So we did acyclovir. We're going to do an antiviral medication is what we did,
Hmm.
versus going down the road of doing herbals, high dose vitamin A. Going down that road is what I would like to have done.
Hmm.
But we're all in a certain situation where you can afford or not afford. So I always offer that. And
Hmm.
that's the direction we went with her. And some patients, that high dose vitamin A has been sometimes brilliant and kickstart things. And you're only doing that for a couple of days, and then you're doing your herbals. Sometimes I will use supplements, but I also like to use gemmos. So
Hmm.
I have sometimes used gemmos as well, and
Hmm.
a combination of those,
Hmm.
plus then even IVs, using IVs. I mean, when it comes to Epstein-Barr virus, this is where we can do artesunate IV. So that's an option as well.
Hmm.
But it's just the cost piece and what can be afforded. But those are sort of the areas. Yeah. And she was at this point in college, in the Kootenays. And so she was not coming in to be treated. So she was there and she's going to college. So also remembering to do things, and it was just easier to do that. But that's
Hmm.
the sort of the two areas or a combination of them too. I've had patients do combination where we're doing a medication antiviral with some supplements. And then I have done, before I've LDI, I was actually doing, I've done and have EBV nosode. So then I would also use the homeopathic along with that.
Hmm.
And I've actually used nosodes to give me information as well about if that is a problem, if they feel, because what you can do is you can do a trial of, let's say it's Lyme, Borrelia, or let's say it's EBV or Bartonella, is take a dose of that nosode, that homeopathic. And
Hmm.
if you feel relaxed and you feel just calm with that, then that potentially could be indication
Hmm.
that is exactly what we're dealing, because with homeopathy is like cures like. So I have a ton of nosodes, and sometimes I use those for an immediate, to tell me immediately if that is. And then we can go down the road of LDI as we wait for it to arrive. We can use the 3 weeks. So there's
Hmm.
some in the meantime. But yeah, so that's sort of when it comes to viruses versus bacteria. Of course, they're going to be different protocols, but I mean, the beauty of being in British Columbia is the ability to write the prescriptions
Hmm.
for those things. And because sometimes it can be having the option because it's covered, right? If she didn't cost her a penny to do the
Yeah.
medication. And now, getting her up and going, and, she's in nursing school, so it's demanding.
Mhm.
And which is kind of neat that she's in nursing, because I'm like, so can you probably take your personal experience and apply it to your
Yeah.
profession?
Remember this.
Yes,
Hmm.
remember this.
Hmm.
But yeah, that's my thinking when I address. Yeah.
Yeah, that's great.
Yeah. Yeah.
Do you see much in terms of like mast cell activation syndrome?
Mm, mm.
Um,
Right.
uh, uh,
So
mhm.
yes. So it doesn't seem to be as profound to me in my office as it seems to be out there. I certainly have considered it with a couple patients. I have two patients on the medication cromolyn, to help with them, but it's not doing much. So I don't think that's the issue for them. But
Mhm.
yeah, it's not as a big um, component of my office, but definitely I have in my back pocket. Yep.
Okay.
To think
Great.
about. Yeah.
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 And another question. So I seem to recall when I came out to visit your practice many, many
That's
moons
right.
ago
That's right.
now,
Yeah.
out in BC, writing a jurisprudence exam
That's
for my BC license, and you were
right.
generous enough to let me shadow you for
Yeah.
half a day, I think. And so
Yeah, that was
I do
cool.
recall I think maybe you had a poster on your wall at the time of the methylation cycle, or we were talking about
Yeah.
genomics and things like that,
Yeah.
to some extent. So I'm just wondering, like, how often would you be working with a patient with complex chronic illness? Again, let's say more like adult neurotypical patients, because I know I think it's statistically a lot more applicable to kids on the spectrum, or other patients on the spectrum or whatnot. But say for adult neurotypical patients with complex chronic illness, how often is it particularly impactful or relevant to be like, oh, we're working with methylated folate or methyl B12, or we're working to help jack up your SAMe, or we're working to support your CBS pathway? Like, how often is kind of that core like methylation
Mm.
cycle and sort of immediately adjacent pathways important in their healing process in your
Mm.
experience?
I think typically always, and I'll have the conversation, because what I love about looking at the pathways too is everything that's involved in those pathways and why we need to perhaps do some nutrients and certain nutrients.
Mm-hmm.
Um, but yeah, taking those methylated forms, first off, if they're on a supplement with more synthetic forms, then we come off of those. And then we dabble in the methylated forms. And what that will tell me in the beginning is if we have a reaction to those, then we're pushing pathways that we shouldn't be pushing.
Mm-hmm.
And so that's also quite telling as well. It gives me feedback of either they felt anxious, insomnia is where I find people, we're just like, I feel like I'm on speed. I can't handle this.
Mm-hmm.
So that I use only methylated forms. Folinic acid, more so with children, leucovorin, then we go up the pathway from methylfolate back up
Mm-hmm.
sometimes, but that's due to a certain reason in children specifically. But yeah, when we look at supplements, certainly I will support with the methylated forms. Some people in terms of mood, will go to SAMe, which is a big methyl donor. Sometimes it's brilliant, sometimes it's not brilliant, but SAMe I'll definitely dabble with. But what I love about the methylation cycle and looking at patients visually, and so I like the poster, because the patients can see and understand how that cycle works, and then why some nutrients are quite important, because it tells me all those coenzymes for each of those enzymes.
Mm-hmm.
And so sometimes either we'll work from bottom up, you'd be at more minerals first to get things moving, and then we'll dabble in methylfolate. I mean, very cautious of the amount of methylfolate that we will use. Some people think more is better, and sometimes I have patients pull back
Mm-hmm.
if they're on, high dose methylfolate. Like, I'm taking 5 milligrams. I'm like, well, maybe let's pull back a little bit on that, and start, lower, maybe 200 micrograms is what you should start with. Because
Mm-hmm.
like, I don't understand why I have either racing heart or insomnia, I can't sleep and I'm taking these supplements. I'm like, oh my goodness. Someone told you about like methylated bees, and I have patients who will be on like 4 different supplements with methylfolate in it. And
Mm-hmm.
it's like, you need to take less. I mean, this is
Mm-hmm.
not okay. Because even pathogens, you're feeding them, you're also feeding them sometimes, and they're eating off of those nutrients. So it's like, well, we need to stop feeding them so well. But also you could be having almost an adverse reaction from these methylated. So it's important to, some people will run their own genetics and see, oh, I'm a combo hetero and MTHFR, and therefore I need to take methylfolate.
Yeah.
Done.
Yeah.
Well, that's not really how the story works. Yes,
Mm-hmm.
you do need some, but you need to be aware that there's way more moving components to this. And that's just one of the cogwheels, and there's so many.
Mm-hmm.
Yeah. Yeah.
I think another thing that came up once on I think one of our naturopathic chat groups or something like that on Facebook, I think was that I believe, and I could be mistaken on this, but I think some B vitamins and maybe methylfolate, I'm not sure, like, or maybe sometimes derived from, like, they're grown on mold cultures and there's
Right.
like residual
Right.
trace. So I
Right.
do wonder sometimes, like, okay, are you reacting to the methylated bees
Mm,
because maybe there's like a super duper sensitivity to molds,
yeah.
or is it that you're upregulating a certain pathway? Or I know like Dr. Paul Anderson talks about methyl or histamine trapping, and sometimes that
Yeah.
will,
Yeah.
jack up the methylhistamine and really drive things up through the roof.
Yeah.
So,
Yeah. You're right. You're right. Absolutely. That sensitivity to the mold,
right.
totally could be part of it.
Yeah.
Absolutely. Yeah.
So I guess one thing I'm wondering is I was maybe 2 or 3 weeks ago now, I had the opportunity to, do you know Dr. Lauren Tessier, ND?
Oh, name
She's
sounds familiar.
she's
Yeah.
she's a mold expert. She's the
Okay.
current president of the ICI
Oh, wow.
group.
Okay. Yep.
She's written a bunch of NDNR articles. She's
Oh,
awesome.
nice. Yeah.
So I was interviewing her, and we were talking about phosphatidylcholine. She's like, "Oh, phosphatidylcholine, like, just so important." And I was saying to her, like, I agree. Like, on paper, so important, and yet when I prescribe it to patients, it's very rare that I see like a symptom change. Like, it's very rare that someone will say, like, "Oh,
Mm,
my brain's working a million times better, or my energy's so much better, or my pain's less." She's like, yeah, no, like, it's just really important to have in place, because then other therapies seem to be able to work better. Actually, I think what she was saying was actually for patients who are really, really sensitive, because she has a lot of patients with MCAS. She's like, we get the phosphatidylcholine in there. It helps to stabilize the membranes. Like, things just seem to go smoother. And so I'm wondering if, in terms of the methylation support, when you get the right dose of methyl B12, methylfolate, and let's just say the patient doesn't have a frank B12 deficiency, but you get the
mm,
right methylation support in there,
mm,
are you seeing, are you typically, because you said like it applies to maybe most of your, adult
mm.
neurotypical complex chronic illness patients, would you say that it's most common that you actually see discernible symptom improvements or clinical changes from the methylation support itself, or is it more that you need to address that so other stuff can work better, or is it a combination of both, or is
Yeah.
it depends?
Yeah.
So,
I think it's a combination of both. I mean, phosphatidylcholine, I'll use that just for more cellular support.
mhm,
And be it we have better cells have better response as well. Things can come in and out better and be
mhm,
used in that per se. The methyl I have, so what I have seen is a bit of increased energy from my non-chronic chronically ill patients. What I can say is in infertility, I have had the pleasure of working with a couple mamas that I can think right now who have had um, miscarriages. And when we started using a prenatal with methylated bees in it, and that's all we changed,
mhm.
we had babies to full term. So
Seen that before a
there's,
number of times. It's
yeah, so
awesome. So
that's
easy,
amazing.
and it's
Yeah.
amazing. Yeah.
It's so easy. And you're like, that was it. And it was just, to me, just so wild of that one change. And I mean, it makes sense of why that would be. And obviously had issues with making methylfolate, or they're having downregulation of their MTHFR. And that folic acid they were taking was down regulating their MTHFR. So, I mean, my one mission is just to get every pregnant mom off of folic acid,
Yeah.
or those trying to get pregnant,
Yeah.
and get on methylfolate. So those are actual where I've seen results.
Hmm.
You know, uh, Objectively, we were having issues, then all of a sudden switched over, and then we have babies. So,
Hmm.
but in terms of other people, I think the problem is the bucket is so full, we're clouded with so many problems that when you throw a methylated bees in there, it just gets lost or not able to utilize it. Maybe it's not even making it to the receptor site. So those, I mean, when you think about like MTHFR and things that down regulate it, I mean, folic acid does, but then you throw metals in there, and metals will affect that. And so, lead to aluminum, you're just not going to get, it's just, you're putting diesel in a car. It's just not going to work. And
Hmm.
so, be it you have a diesel truck and it should take diesel, but maybe you've got sand and you've got things within it that just engine can't operate. So
Mhm.
I find that I'll put that in there, and I don't expect profound changes when I have someone that is just littered with inflammation, be it mycotoxins, we have infections, and now we have, we've got metals to deal with, and it just really gums everything up, and we can't get the full effect.
Mhm.
So yeah, but at least it's helping. It'll be help keep things going too, so we don't completely lose our capability of our energy and whatnot. So it's kind of still kind of helping, but yeah, I
Mhm.
don't have these like, wow, methylfolate. That was incredible. No.
Mhm.
SAMe, though, I have with patients with mood.
Mhm.
And of course, with infections, you can have mood changes, and be it
Mhm.
it's rage, anger, panic attacks, high anxiety. I have with SAMe, I have had patients feel more mood stabilization with SAME. Yeah, which is a
That's
big
great.
methyl donor. Yeah.
Yeah, that's
Yeah.
great. Just one last little question on methylation. I'm just
Mhm.
curious. So I'm assuming that you're familiar with the new Brander protocol for kids with like for methyl B12 shots for kids on the
Right.
spectrum.
Yes.
Have you
Yes.
ever, just out of curiosity, have you ever extrapolated that and tried it with adults, like adults, like neurotypical adults?
No, I
Um,
haven't, but that is such a great idea. Like, it's such a great
thank you.
idea.
Thank you. I thought it
Yes.
was. So I I was just curious.
Write that down. Write that down. Yeah.
Nice, nice. Please do. Yeah, it's I've been doing that for years with patients, not everybody, but one of the things like I did Ben Lynch's,
Mhm.
genomic training like way back in the day, and like,
Yeah, me too. Yeah. Yeah.
studied Amy Yasko's stuff back in the day, and
Yeah.
Paul Anderson's, and like, just lots
Yeah.
of genomic stuff. And one of the things that I've sort of been a little bit I don't quite want to say underwhelmed with, in part because it's not a real word, but it's just that I haven't really seen like a lot of like huge profound changes. Like, yes, like it's wonderful when methylfolate helps to facilitate a woman having a successful pregnancy and all that, like for sure,
Mhm.
like amazing things like that. But in terms of the complex chronic illness realm, not that often that it's a huge game changer,
Yeah.
in my experience as well. But with the methyl B12, yeah, I found that using that protocol for patients, it sometimes worked really well. So like we'll teach them how
Mhm.
to self-administer. We get the super concentrated B12, and they'll start by doing an injection, like a sub-Q self-injection every couple of days, building up to the dosage in question. And sometimes it just doesn't work at all.
Right.
But there are some patients, like I'd say probably for every, give or take, bearing in mind I'm trying to very well select the patients, I'd say probably like 1 in 3 patients has like a really good response to it. Like it really helps their energy. Sometimes it's been the only thing that's helped to address like neuropathy that people are dealing with too, just as
Right.
kind of another side clinical pearl.
Yep.
But
Yep.
yeah, sometimes it can be really helpful. And I find it's quite rare that people flare from it. I mean,
Right.
obviously we
Yep.
test drive first, like if you can tolerate, sort of a standard, like, 1,000 micrograms of methyl B12,
Yep.
okay, then we can, or maybe we'll do 5,000 just to be safe. And it's like, okay, let's start dabbling with this a little bit. But anyways, I was just curious if you'd played with it,
Well,
because
no, and I'm going to now. Thank you for that.
enjoy.
Um, but one of my patients who's really sensitive to supplements, and oral methyl B12.
Hmm.
He we've been doing B12 shots with her,
Hmm.
and she has been having really good results that way.
Amazing.
So, bypassing the gut, going straight into the muscle tissue. I mean, it's just straight to the cells that way, which is why I really like it.
Hmm.
And I have been going up on that potency
Okay,
with
cool.
patients too, and sort of skipping the lower potency and just going for the higher potency. And it's simple and easy.
Yeah.
And I've had patients that have been on the cyanocobalamin and then switching them to
Hmm.
methylcobalamin. Let's do that instead.
Hmm.
That has been, and so be it, we just have an issue with absorption, or which is the issue with absorption, and be it that's intrinsic factor is the problem. But yeah, no, I'm going to use that and add more to the B12 shot for sure.
Cool.
That's awesome. Yeah.
Great.
Yeah.
Yeah, I think there's something about it being sub Q too. Like I know he talks about it being more slow release, and like I feel like that's probably a big thing, because like we've had patients where they're getting, like we'll do some kind of like extra high dose Myers cocktails, for example. And like sometimes that's like not really packing much of a punch, and yet doing it sub Q, works well. So like I think there's some kind of magic there with a slow release maybe, but he was onto
Yeah,
something, that Dr. Newbrander.
because it's something interesting. I mean, I have patients where I've done B12 shots and have great results. And then we're like, okay, let's do an IV. And they had similar results with the IV. And it's like, interesting.
You'd think it would be so much more like boom,
so much
but
more. Exactly. Because then I was going same, if not a bit more in the bag, plus a ton of other things. And I thought that energy that they would have had a different reaction, a longer lasting reaction. And it wasn't. It was so we've gone back to just B12 shots. And which is interesting. So it's good to know.
Mysteries of the human body, Dr. Bean.
Exactly.
I'm telling you, just never a dull moment.
No, not a walking textbook ever.
No, definitely not. Well, Dr. Bean, I know we're kind of getting up on our hour here that we were planning to talk for. So before we wrap up, person who's listening, they're thinking like Dr. Bean is just this brilliant force to be reckoned with. She's the kind of doctor I want to have in my corner. But they don't live, in Salmon Arm, BC, or maybe nowhere in BC. Is there a way that folks can work with you if they live somewhere that's not right handy to working with you in person or within BC?
Yeah, so totally. So I recommend that you find a local naturopathic doctor, and then I will work with you. And so you're going to have two heads are better than one when you're outside of the province. If you're in the province, then we're going to work together and we're going to do telemedicine if you don't live in Salmon Arm. But if you're out of province, and particularly if you want me to start writing prescriptions for you, you need to come to British Columbia in order for me to do that. Or we'll work with a local ND together. Yeah. And I do that all the time. Yeah.
Wonderful. Okay, great. And so the best way to get your contact information would just be through your website, I'm assuming?
Yes. Yeah. So either tailormadewellness.com or doctors and DR tailorbean.com. Either way, those two websites. Great. And then I'm on Instagram. I say we as the clinic and myself are on Instagram, and it's Dr. Taylor Bean again on Instagram, same spelling. That's more where my thoughts go, is Instagram. The website is, of course, for information, but kind of dialogue. I have particular subject matter that I discuss on Instagram. Yeah. Yes. Yeah.
Okay. Well, I'll include your both the websites and your Instagram and Facebook. Or is your Facebook just a personal, or is that a
no?
clinic?
And I do have Dr. Taylor Bean Facebook. Okay. It's sort of active just because the Instagram posts go to the Facebook. Okay. I don't really do Facebook. It just goes to there. Gotcha. But so I more head to Instagram for more of that conversation piece. Okay. Yeah.
And then just the kind of follow-up question on all of that. So if are there ways that folks can sort of access your brain, or are there things that you offer outside of consulting on cases? Like, do you have any online courses or different things people?
Yes, thank you for asking. I do have a webinar series, vaccineoptimization.com. So I do a lot of work in the vaccine world. We didn't talk about it today, but I have an 8-part vaccine webinar series. And we go through multiple subject matters within that because it's such a very large topic. And it is a topic that should be open to discussion. And I find that it's not. So I have therefore created these webinars. The first one is on infant immunity, which I find is very important. It's mostly around children, but you can apply it to yourself too. But first one is on children's immunity. Second, pregnancy and breastfeeding. Third and fourth is just on viruses and bacteria that we vaccinate more so in childhood. COVID is not on there because it was pre-COVID. And then I get into aluminum and SNPs, genetic SNPs, because a lot of people say with MTHFR, I can't get vaccinated or something along those lines. I think you are absolutely missing the boat when you talk about MTHFR. There's a whole other slew of SNPs you should be discussing. So MTHFR should actually be left to the side, and these other SNPs should be talked about. And then I talk about safety, efficacy, and science. Then my seventh one is about how to simply optimize your kids' health, like regardless of vaccination. How do we just help kiddos thrive? And then the eighth one is myself as someone who offers vaccines in my office, because here in BC we can, what that looks like for someone who does vaccine optimization. So that's the eighth one. And vaccine optimization in terms of working with people across the country is the topic that I usually work with patients, consult with, because there's a lot of questions. There isn't treatments that are happening. It's more of it's a consultation, a consult around your questions, because you find that no one is there willing to or knows and allows for you to have a conversation. So yeah.
Great. Yeah, I haven't had an opportunity to do the webinar series, but just from what I've seen you post on social media and just seeing how you frequently speak at medical conferences about this topic, like anyone who's listening to this thinking like, oh, I'm interested in that, and like, is this going to be a good fit? Like, I feel like you bring such a balanced perspective to things and like such a well-educated perspective to things. At the end of the day, with something like this topic, in my humble opinion, like it really shouldn't be like, oh, is it a balanced conversation? It's more like what does the evidence say, you know? And then I feel like that's what you lead with from what I've gleaned. So I think it's very, very it's great that you're offering that, and
Thank you.
anyone watching it would be well served.
I try to take the emotion out of it. It should be, to have a conversation, take the emotion out, because the emotion really gets in the way. And so, it's tough to have a conversation, and there's a lot of, mentally, for some people, it's a very, brings a lot of anxiety, a lot of fear, fear coming from just having the conversation with someone, and what that's going to look like and how they're going to be treated. And, no one likes to be shamed or gaslit, so that we just avoid the conversation, which is not helpful. And I should be speaking at, first time ever is MAPS.
Oh, wow.
So that's pretty exciting. So that'll be in March, in South Carolina. They're not doing it in Florida because that's season for what happens out in Florida. Was it hurricanes?
Probably.
So they've moved it from Florida to South Carolina. So anyway, that's in March. So so hopefully then that also will happen in California in September. But
awesome.
I'll be speaking there on this subject matter. So MAPS, so those that don't know, Medical Academy of Pediatric Special Needs. So that's and I just found out today that I am now a fellow with MAPS.
Congratulations.
Thank you. The only one in British Columbia, which is pretty cool.
All right.
So I'll be sharing that. Yeah.
That's awesome.
It takes a while to be a fellow. I mean, you have to attend at least 3 times, and you need to work with someone. And, but that finally got that finished.
That's
COVID
awesome.
extended it for a couple of years. So, but yeah. So anyway, so that conference is where get to be in front of tons of pediatricians and, medical doctors and PhD and so forth. So, really honored to be able to go and do that. So,
that's awesome. That's the big time in that realm.
Yes,
so,
it is. Sharing the stage with a lot of important people. So, so anyways, so that's coming. If there's anyone that attends those, I'll be there in March. So,
Wonderful. Great. Yep. Well, thank you so much for taking the time to speak with me today, Dr. Bean. It was a fantastic conversation, and always enjoy communicating with you. It's nice to actually get to chat with you again. It's probably not been since I visited you many years ago, but we've communicated, through Messenger or whatnot since then. But it's been really nice to chat. So thanks so much. And
of course, thanks for having me. This is awesome.
My pleasure. And thanks so much, everyone, for tuning in. And we will leave it there for now. So until next time, thanks, everybody.